It is estimated that at least 1 in 4 adults in India has hypertension, but only about 12% of them have their blood pressure under control. High blood pressure. A silent killer? High blood pressure typically has no symptoms, but it causes progressive harm to the cardiovascular system. When blood pushes with too much force through the cardiovascular system, it can damage the walls of the arteries as well as the heart muscle. High blood pressure can lead to other disease condition in the body. What is hypertension or high blood pressure? Hypertension, also known as high blood pressure, is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. Hypertension is diagnosed as systolic blood pressure as greater than or equal to 140 mm of mercury and diastolic blood pressure as greater than or equal to 90 mm of mercury. There are 4 stages of hypertension. If systolic blood pressure is less than 130 and diastolic is less than 85, it is considered as normal stage. If systolic is between 130 to 139 and diastolic is between 85 to 89, this stage is classified as high normal. If systolic is between 140 to 159 and diastolic is between 90 to 99, this stage is classified as grade 1 hypertension. If systolic is greater than or equals to 160 and diastolic is greater than or equals to 100, this stage is classified as grade 2 hypertension. Risk factors of hypertension. Modifiable risk factors, things which we can change, are abdominal obesity, smoking, physical inactivity, psychosocial factors, high cholesterol. Non-modifiable risk factors, things which we cannot change, are ethnicity, age, gender, family history. Signs and symptoms of hypertension: severe headaches, nosebleed, fatigue or confusion, vision problems, chest pain, difficulty in breathing, irregular heartbeat, blood in the urine, vomiting. Types of hypertension: primary hypertension, secondary hypertension, gestational hypertension, uncontrolled hypertension. The only way to detect hypertension is to measure blood pressure. If diagnosed with high blood pressure, to confirm the diagnosis, check for underlying conditions that can cause hypertension. Diagnostic tests. Ambulatory monitoring. Lab tests like urine test, blood test, cholesterol test, etc. Electrocardiogram. Echocardiogram. Take your medicines as prescribed. You should always take blood pressure medications as prescribed by your doctor. If you skip doses because you can't afford the medications or you have side effects, talk to your doctor about solutions. Don't change your treatment without doctor's consultation. Healthy eating to lower blood pressure. Whole grains, vegetables, fruits, dairy products, lean chicken, meat and fish, nuts, seeds and legumes. Use sugar sources like agave nectar, fats and oils. Foods to avoid. Baked foods such as biscuits, baking powder, preserved foods such as pickles, ketchup, canned foods, cakes, peanut butter, potato chips. 8 lifestyle changes for low blood pressure. Reduce sodium in your diet. Read food labels and limit your sodium intake to 1500 mg or less per day. It can reduce BP by 5 to 6 mm of mercury. Exercise regularly. Regular physical activity, about 30 minutes daily, can lower your BP by 5 to 8 mm of mercury. Limit the amount of alcohol you drink and quit smoking. By drinking alcohol only in moderation, you can potentially lower your blood pressure by about 4 mm of mercury. Generally, 1 drink a day for women, and not more than 2 a day for men. Quitting smoking can reduce your risk of heart disease and improve your overall health. Cut back on caffeine. Reduce your stress and sleep well. Relaxation can lower blood pressure and quality sleep ups your energy. Lose weight. Losing just 10 pounds can make a big difference. Check your blood pressure as often as your doctor recommends. Get support. Supportive family and friends may encourage you to take care of yourself and overall can help improve your health. Incredible yoga asanas for high blood pressure. Forward bent pose. Legs up the wall pose. Bridge pose. Downward facing dog pose. Corpse pose.